Okay, hi Melvin. My name's Erica. I'm going to be your provider today. How are we doing?
Good, how are you?
I'm doing well. Today we're going to be doing a complete neurological exam, okay? Do you have any questions or concerns before we begin?
No.
Okay, great. Let's just get right into it. So the first thing we're going to do is we're going to be testing your olfactory nerve, okay? That's the first cranial nerve. So what I'm going
Okay.
to have you do is you're going to go ahead and close your eyes for me. Go ahead and cover your left nostril. And I'm going to have you tell me what you smell in this right nostril.
Alcohol.
Okay, go ahead and cover your other nostril. Great. And we're going to do the same thing on the other side.
Alcohol.
Okay, correct. That's an alcohol swab that we have there. So the next thing we're gonna do is we're gonna test your cranial nerve number 2. Okay, that's the optic one. So what I'm gonna have you do is you're gonna hold this card up to your face, about right here, about 14 inches away. That's great. And you're gonna go ahead and cover your left eye, and I'm gonna have you read this line right there, just as best as you can.
372646.
Okay, great. And we're gonna go ahead and switch hands, and we'll have you do the other hand.
372646.
Great. So you got vision 20/20. You don't wear any glasses or contacts, correct? Okay.
No.
You don't need them. So what I'm gonna have you do is go ahead and face your body towards me. So the next thing we're gonna do is we're gonna test your peripheral vision, okay? So I'm gonna have you cover your right eye with this, and you're gonna kind of match me. There you go. And what I'm gonna have you do is you're gonna tell me when you can see your fingers, my fingers, okay?
I could see them. I could see them. I could see them.
Great. We're gonna head and switch sides. We're gonna do the same thing, okay?
I could see them. I could see them. I could see them.
All right. Great. So the next thing that we're gonna do is I'm gonna take a look into your eye, okay? So this is going to be an exam of the eye, okay? And I'm going to also take a look at your reflexes as well while we're doing that, okay? So go ahead and just look straight forward. And I'm going to take a look at your pupils and make sure how they constrict and react to light. Great. Look straight forward for me. Okay. I'm also going to take a look and make sure when I flash the light in your left eye that the right eye and the right pupil constricts. Perfect. And same thing on the other side. Okay. Great. So I'm going to go ahead and do an exam of the eye. So go ahead and just look straight forward, okay? What I'm going to do is I'm going to tell you when I hit that red reflex, and I'm going to take a little bit of a closer look, okay? Just keep looking forward. If you have to blink, don't feel like you can't blink. Just blink whenever you need to, okay? Okay, great. Go ahead and blink if you need to. You okay with the other side?
Mm-hmm.
Okay. Go ahead and blink if you need to. So everything looks good there. I was able to get a good clear visualization of the optic nerve, of the disc. Everything looks sharp. There's no blur or anything like that. The fibers, everything, and the blood vessels look okay. And I was able to see your macula. So everything looks okay there. So the next thing that we're going to do is I'm going to have you keep your head forward. Do not move your head. But I'm going to move my finger around, okay? So follow my finger with your eyes, okay? So we're going to start here. And as I move my finger again, follow my finger, but do not move your head, okay? Perfect.
Mm.
Keep on my finger. Okay, great. I know it's a little weird to be off. That's just testing your cranial nerves 3, 4, and 6. So everything moves okay. There's no signs of nystagmus, and you're able to appropriately follow my eyes, which is good. So the next thing that we're going to do is we're going to test the trigeminal nerves. So what I'm going to do is I'm going to grab a couple things, okay? So if you can put your hand out for me. This is going to be something that's dull, okay? So you feel it's kind of dull. This is going to be the sharp, okay? And then this is something that we're going to use for a soft, okay? So I'm going to put this on various points. Go ahead and close your eyes for me, and you're going to tell me what you feel, okay? What's this?
Dull.
Okay, how about this one?
It's soft.
Okay. How about this one now?
It's sharp.
Okay, great. We'll try again on this side.
It's sharp.
Okay. How about this?
It's soft.
Okay. How about this one?
It's soft.
Okay. This one?
Soft.
And how about this one?
That's dull.
Okay, great. Sorry, I know they're a little confusing, so you did good there. So the next thing that we're going to do is I'm going to put my hands underneath here. Try to open your jaw against my hand. Okay, perfect. Good strength there. Okay, so what I'm going to have you do is we're going to test the next facial, the next nerve, and that's going to be the facial nerve. Okay, so that's cranial nerve number 7. So what I'm going to do is go ahead and frown for me. Make a frown face. There you go. Okay, go ahead and smile and show me your teeth. Okay, and can you puff out your cheeks like a puffer fish? Okay, great. So the next thing we're going to do is test the 8th cranial nerve, okay? So what we're going to do is it's 8th cranial nerve is your hearing, okay? So I'm going to get next to this right ear, and I'm going to whisper a couple words, okay? I want you to tell me the words that you hear me whispering, okay?
Apple.
Okay, great.
Banana.
Okay, we're going to do one more, okay?
Orange.
Okay, great. We're going to do the same thing on the other side, okay?
Grape.
Okay.
Peach. Apple.
Okay, great. So your hearing is all good. The next thing that we're going to do is we're going to do 2 different tests, okay? So one is called the Weber test. That's the first one. So what I'm going to do is I'm going to put this up to the top of your head, and I want you to tell me if you hear it in both ears or if you hear it louder in one ear or the other, okay? Okay. Ready? So tell me, can you hear it in both ears?
I hear more on this side.
Okay. How about right here? Is it equal?
Equal.
Okay. Is it still equal?
It went away.
Okay. Want to try one more time?
Mm-hmm.
Okay. Tell me, is it equal in both ears or is it louder in one ear or the other?
It's equal.
Okay. So what we're going to do the next one is I'm going to do the same thing. I'm going to make the noise, okay? I'm going to put it on the little process here right behind your ear. And what I want you to do is I want you to tell me when you stop hearing the noise, okay? Tell me when you stop hearing it.
I don't hear it anymore.
Okay. Do you still hear it? Tell me you don't hear it here.
I hear it.
Tell me you no longer hear it. You still hear it?
Mm-hmm. I don't hear it anymore.
Great. That's about 10 to 30 seconds after, so that's good. Okay, so now that we did the 8th cranial nerve, the acoustic, and we know everything's okay with that, we're going to move on to the 9th and the 10th cranial nerve, okay? So that's going to be testing just the glossopharyngeal, so that's going to have to do with your tongue, okay? So the first thing that we're going to do is we're going to take a look at your uvula. So I'm going to go ahead and use this little bit of light, and I'm going to have you open up your mouth, and I'm going to have you say, One more time. Okay, great. And go ahead and swallow for me. Swallow. There we go. And then open your mouth up for me. And I'm going to put my finger right here, okay, right against your tongue. Go ahead and push against my finger. There you go. And then we're going to do the same thing on the other side. Okay, great. So that's just showing me that the 9th and the 10th cranial nerve are intact, okay? So what we're going to do is we're going to go ahead and also test that 12th nerve. And that you're going to go ahead and show me that your tongue. One more time. And I'm just going to make sure there you go. Nice in the midline. I'm going to take a look at this side, that side. Okay. So that lets me know that the 12th cranial nerve is also intact. So what we're also going to do is we're going to check that 11th cranial nerve, okay? So this is going to be the accessory. So what I'm going to have you do is go ahead and shrug your shoulders. There you go. Okay. Go ahead and relax them. And then I'm also testing your strength as well. So what I'm also going to have you do is we're going to see kind of how your facial muscles move, okay? And so what I'm going to have you do is I'm going to have you turn your head to the left. And then don't let me move your face back. So go ahead and find my face. Okay, great. Go ahead and turn your head this way. Go ahead and find my fingers. There you go. Okay, so your muscle strength is good. So lets me know that the 11th cranial nerve, the accessory nerve, is also intact. So the next thing that we're going to do is we're going to kind of move on to your just your cognitive status, okay? So what I'm going to do is I'm going to just kind of give you 3 words, okay? So I'm going to give you those 3 words. I'll have you repeat them to me, and then in a little while we'll see if you can recall those same 3 words, okay? So the 3 words are going to be cat, dog, and bike, okay? Go ahead and you go repeat those for me.
Cat, dog, and bike.
Okay. We'll go back to those in a second and see if you can still remember those for me. So can you go ahead and tell me what year it is?
2018.
Okay. And what season are we in?
Spring.
Okay. And do you know what month it is?
May.
All right. And what day is today?
The 19th.
Okay. And what day of the week is it?
Saturday.
Okay. Great. Can you just repeat those 3 words that we just went over?
Cat, dog, and bike.
Okay, great. So that lets me know your memory is intact, that you can repeat something, and that also you have a short-term memory that's able to recall those words even after a couple times and even after we distracted you a little bit. So what we're also going to do is we're going to check your gait, okay? So what I'm going to have you do is we're going to check your cerebellum function. That's just the part of your brain. So what I'm going to have you do, if you can go ahead and get up for me, and I'm going to have you walk along to that wall over there for me. Okay, so go ahead and walk there. Great. Go ahead and turn around. And we're going to do a tandem walk, okay? So you're going to kind of have foot to foot to foot. Go ahead and walk that way towards me. Okay, great. And now going back, I'm going to have you just walk on your heels. Okay, that's okay. And do the same thing, now walk back to me on your tippy toes. Okay, great. So while you're standing right here, I'm going to go ahead and test the Romberg test, okay? So what that's going to do is you're going to have put your arms out for me. Go ahead and put them out. Okay. And you're going to go ahead and close your eyes. And then we're going to just have you keep your arms right there, okay? And I'll let you know when you can go ahead and open your eyes. Okay, great. Go ahead and open your eyes. We'll go ahead and keep you like that. Go ahead and keep your arms out for me. Okay, great. Okay, you can go ahead and sit down. Go ahead and put your arms down. Okay, so what we're going to do is we're going to do, just check some things. So go ahead and close your eyes. I'm going to put some things in your hands, and if you can just tell me what's in your hand, okay? So go ahead and open up your hand, and I'm going to put something right here in this hand. Can you tell me what that is?
Pin.
Okay, great. And then this on the left hand, can you go ahead and tell me what's in that left hand?
Key.
Okay, great. So that just lets me know that you're able to tell what's in your eye, what's in your hands. Go ahead and open up your eyes. Okay, so the next thing that we're gonna do is we're gonna test your motor senses, okay? So I'm just gonna go ahead and test your the strength, and we're gonna kind of compare it from side to side. So we know we tested your shoulders, but we'll go ahead and do it again. Go ahead and lift your shoulders, raise them. There you go. Okay. And then your arms. Go ahead and put your arms kind of out like this. Okay. Go ahead and push your arms down against mine. There we go. And up. Perfect. And then go ahead and squeeze my hands. Okay. Everything's nice and equal and just as strong as both head. Keep them up for me. And go ahead and push them down against me. There you go. And push them up. All right, great. So that lets me know that your strength in your upper arms is all equal and expected, and it's good bilaterally. And your finger strength is also good. So we're also going to test your lower extremities. So I'm going to go ahead and put my hands right here on your legs. Go ahead and lift your legs up. There we go. And go ahead and your lower legs here. Go ahead and push your legs out against mine. Great. And then we're going to go ahead and go down to the feet. So I'll have you go ahead and lift your feet up against my hands. Great. So your muscle strength is very good, and it's also equal bilaterally, as I would expect it to be. So the next thing that we're going to do is we're also going to test just your sensory. So that's going to let me know if you're able to sense different kinds of feelings, kind of what we did almost with the upper arms, with the soft and the sharp. So if you can go ahead and just roll your pant legs up for me, and we'll go ahead and test that that tactile feeling. Go ahead and lower limbs. Okay, that should be perfect right there. And then after that, while we have your pant legs rolled up, we'll go ahead and test the arms and the reflexes as well. Okay, great. So we're going to go ahead and do that same sharp and dull. So go ahead and close your eyes for me. Okay. And you're going to go ahead and tell me what you feel and whether it's sharp or dull, okay? Can you close your eyes? Tell me what it is. What do you feel there?
Sharp.
Okay. And how about on this one?
Dull.
Okay. And how about down here?
Sharp.
Okay.
Dull.
Okay. Great. So, while we have you right here, what I'll do is I'll go ahead and take a look at your reflexes on the arms, okay? So, go ahead and relax your arms. And I'm just going to go ahead and check your reflexes, okay? Go ahead and wiggle your thumb for me. There you go. Okay, go ahead and relax it. Okay, great. We'll check right back here on the triceps. Okay, great. And your reflexes are nice and strong as I would expect. Go ahead and, there you go. Okay, relax. Okay, great. So we'll do the same thing on this side. Go ahead and wiggle your thumb for me. Okay, go ahead and relax. There you go. And we'll check the tricep on this side. Okay, great. And we'll check the bicep reflex right here. There you go. All right, great. So your reflexes are nice and strong, and they're also equal bilaterally. So that's good because that lets me know everything's the same on both sides. Okay, so now that we checked your arms, your reflexes in your arms, and they're pretty strong and 2+ as we would expect, I'm going to go ahead and check your lower extremity reflexes, okay? Just go ahead and relax your leg, okay? I'll try and flip for this. Can you sit back a little bit for me? There we go. There we go. Check this side. There you go. Okay, go ahead and take off your shoes for me. Okay. And then we're going to go ahead and just have you relax your feet right there. And we're going to check your reflexes down here, okay? There you go. That's about a 2+ also. And everything's nice and 2+ as we would expect. So I'm going to go ahead and lift your foot. And I'm just going to go ahead and check the bottom part of your reflex. Okay, your patellar reflex is good and intact. Okay, everything is nice and intact there. Great. So what we're going to do is we're going to also do that same thing that we did with the sharp and the dull. We're going to do that in the lower extremities, okay? So what I'm going to have you do is we're going to do, tell me if it's sharp or dull, okay? So can you close your eyes and tell me what this is?
Sharp.
Okay, and how about this one on the other side?
Sharp. No, that's dull, sorry.
That's dull?
Mm-hmm.
Okay. And how about this one?
That's sharp.
Okay.
Sharp.
Okay, great. Go ahead and open your eyes. So everything looks good. Everything is nice and intact. Your reflexes are all very strong and expected, and nothing is abnormal or delayed. Okay. Do you have any questions?
No.
Okay, great. So if you don't have any further concerns, we will go ahead and meet you next time when it comes for the next thing. Okay.
Okay, thank you.